Hi, we're here with Catherine Hanssen, Executive Director of the Center for HIV Law and Policy. Hey Catherine, what have you been up to this week?
Hi David. Other than lots and lots and lots of walking, on Tuesday I moderated a panel on whether or not informed consent is in fact the barrier to HIV testing and entry into care that a growing number of physicians and the CDC has suggested it is. And it was a very interesting panel. We had one of the panelists was Adele Webb, who is the director of the Association of Nurses in AIDS Care, who pointed out that although doctors are the ones who were involved in drafting the guidelines and are the biggest, the loudest voices in saying that this is a waste of provider time to counsel people before testing, that in fact it's the nurses who are actually drawing the bloods and doing the testing. And if it isn't the nurses, it's probably the physician's assistants. And those nurses think that informed consent and the documentation of it is actually pretty essential to the quality of care and engaging people in care. And you know, as was pointed out, if FedEx doesn't document that they delivered a package by making a little notation saying they did it, if you want to document that something happened, you need the person that was supposed to receive the service, such as the opportunity to say, no, I don't think I want to get tested, to rest with the patient. And one of the other things that was really quite interesting is when the question was posed as to whether it was ethical, at least in the United States, to have opt-out testing programs or aggressive opt-out testing programs without guaranteed linkage to care. In other words, is tag and release ethical in this country? The question was posed to a representative from the CDC, Linda Valeroy, and I have to say, who very graciously attended and participated in the panel. And she indicated that the CDC guidelines were drafted kind of with the mind that we live in a perfect world where these services would be available to everyone. Unfortunately, in many parts of the country, and even in the South, that perfect world is yet to materialize. We are not living in Camelot. We are living in Alabama and Tennessee, and even in New York City, many thousands of people who have been tagged are still released and not in care. So it was an interesting panel, and what's always frustrating is that one worries that the people in the audience are the last people that need to hear the message, and the people that you wish would listen are not around. But and on that note, though, I've seen many of the doctors who do not have the time to talk to their patients wandering around the halls of Centro Banamex, while Dr. Jeff Birnbaum, a supporter of informed counseling, of informed consent, is back home talking with his patients. So David, it's nice to see you, nice to chat with you.
And hopefully those that need to hear it will see this video feed. If people want more information about ethical and responsible testing policy, where should they go?
They should go to our website, which is www.hivlawandpolicy.org. We have a comprehensive collection of resources, including quite a few materials on HIV testing. In fact, materials from you, David, and the AIDS Foundation of Chicago, and a set of principles that, as you know, we authored with Lambda Legal that sets forth a variety of principles that we think should be taken into consideration when organizations, whether they're healthcare organizations or community organizations, decide to put an expanded testing program into the works.
Great. Thanks, Catherine.
Thanks, David.